You know, sometimes it seems like we've been dragging our feet in this fight. We had months of warning from China that this virus was coming, and then we could see it hit Italy, which has now got between 600 and 800 people a day dying. Yet we still took too long to ban those flights from overseas that flew in this virus. We took too long to start checking that people really were quarantining themselves at home if they were sick or had just flown in from overseas. Do you know it's only today that Victoria Police said it now had a squad of 500 officers who'd be ringing or knocking on doors, something I said should have been happening last week already, probably before then, really. And even then it was too late. But are we still too slow? Joining me is Professor Bruce Thompson, Dean of Health Sciences at Swinburne University. Professor Thompson, thank you so much indeed for your time. What do you think needs still to be done?
Well, as you've just talked about, we really need to increase our social isolation as much as we possibly can. So anything, as you just mentioned, in terms of trying to distance ourselves from each other is absolutely the right thing to do. And we need to just keep on doing it as much as we possibly can.
Now, what about public transport? We've got limits on people indoors of up to 100. You go down to the railway station, I tell you what, there's more than 100 in a train.
That's like the $60 million question. We're trying to get everyone to distance themselves from each other. However, we're quite happy for someone to stand on a train with another few hundred people. Obviously, trains are an essential service, and so it makes it really difficult, and the government, I'm sure, is actually caught in a bind of, do you actually stop this particular essential service with a lot of people who can't actually travel or can't drive or don't drive, and this is the only form of transport, versus trying to distance everybody. So we need to think of other ways that we can try and make it a lot easier for people to travel, but also potentially distance themselves if they are using public transport.
Why not run peak hour services all through the day?
Absolutely, and that's obviously going to spread the number of people on each individual train. We're sort of getting a natural attrition anyway, because a lot of workplaces are actually asking people to work from home. That's the case at the university I work at. So therefore there's less people on the train, but if we had more services, then less people would be on each train, and then obviously that makes it easier to social distance from each other.
Now, you must have been looking at this thinking, why are we so slow at times to react, to take this so seriously? What's your view on that?
Well, we're actually doing quite okay. I know it seems slow, and we've known about this virus for a period of time now, but Australia has actually been a bit of ahead of the curve. We know that this is going to increase significantly, but we actually have this really small buffer to try and get everything into place before we actually get the huge increase in the numbers that we're actually expecting to get. So we're actually doing really quite well, but with all the measures that we're doing. I know it sounds slow, but we are doing really quite well.
Yeah, I thought the ban on travel from overseas came in, I must say, too late. I was wondering, I wrote a column a week before that saying, why are we letting people in from Italy when they've so far brought the infection to 50 different countries plus? But that said, you're right, and the government's got 4 factories working helter-skelter to create more ventilators, so all that's good. Now, here's the thing. Tell me whether I'm grasping at straws here, but we've got the widest testing regime now in the world, and what we've found as of this morning is that 1,700 Australians have the virus. So far, still just 7 have died from us. That gives us a death rate so far of just 0.4% of people infected, which is less than half of what the government was expecting. Is it possible, Professor, that this virus is less deadly than first feared?
Well, it seems to be that the viruses are behaving differently in different countries. Now, clearly in Europe and other parts of the world, they're in a very cold climate at the moment. It's winter, and they're just coming out of that. However, in Australia, we're actually sitting in the middle of coming out of our summer. Is it due to something like that? We just don't know. Our healthcare is brilliant. We are very, very fortunate in this. So I'm actually thinking this is a really good thing. You know, if we're actually not as affected as in other countries, surely that's actually a major relief for us.
Well, I love the note of hope. Now, don't spoil it now. I'm going to ask you, is there any hope of a vaccine soon?
Well, the vaccine's definitely going to happen, but it just takes a little bit of time. We obviously don't want to develop a vaccine and all of a sudden we find out it does more harm than good. But most vaccines or any drugs take some period of time. We're still looking at 12, maybe even 18 months away before we actually have a vaccine that is suitable to be put across all the population. That is extremely quick in terms of drug development. These things take 10, 15 years normally. However, we are very, very good at developing vaccines and demonstrating their effectiveness. So it's just, it's not a waiting game. They're trying as hard as they possibly can to really get something that's worthwhile.
Oh, they're the heroes in this particular war, I'll tell you that. Professor Bruce
Absolutely.
Thompson, I very much appreciate your time. Thank you so much.
Absolute pleasure. Thank you.